Vikas, you may mute yourself, please.
वो दोनों मत कीजिए डिलीवर का
Good afternoon, everyone. We'll just start the webinar in just 5 minutes. We are just waiting for everyone to join. I hope everybody can hear us. We are just starting in 5 minutes. In 5 minutes, we are just starting. We are just waiting for everyone to join. By 3:12, we will just start the webinar. I hope everybody can hear us. You can type in the chat box if you can hear me. Great. We will just start. Dr. Ram, Dr. Sachin, can we start now? Avneet, can we start?
Yes.
Yes, I think we can.
Yeah,
It's
yes,
3:10, so let's start the webinar. We have 160 attendees and still they are increasing. So by the meantime, they join, we can start the webinar because a lot of people have been waiting for at least 10-15 minutes.
Yeah.
I'll start the recording. So we'll start the webinar. Good afternoon. Namaste, doctors. I welcome you all. I warmly welcome you all to this virtual CME in Ayurvedic Management on Diabetes, which is organized by Kerala Ayurvedic Group in collaboration with Nature Fit. Allow me to introduce myself. I am Rishabh Gupta, Vice President Marketing for Kerala Ayurvedic Group. I hope everybody is able to see all of us and my voice is completely audible. I would like to listen to from you all. We are audible. I hope you all can see us. We are visible. Great, very good, very good. So, let's do. So, I hope you all are in good health, and we are excited to do this webinar. And I hope let's do a short poll by getting introduced with each other. So I'm going to launch a poll where we will understand that आप लोग कहाँ से हैं, where are you from, what is your profession, what is your business. So let's understand each other and probably we'll take the webinar forward. So I'm launching the webinar right now and let's do a short poll and understand each other. I hope everybody can see the poll which is live on the screen. I would really request everyone to do a poll on the live screen, which is displayed in front of your screen. Very good, fantastic. Great, I see a lot of participation happening. A lot of people have already attended the last webinar of Karali. That's great. People from Delhi, NCR, Kerala, Maharashtra, Tamil Nadu, Gujarat. In fact, I can see a lot of people are coming from outside India as well. That's so nice. I'm so grateful for everyone to coming to the webinar and taking time to attend this valuable and insightful webinar. I'll just make the poll live for the next 30 seconds. I would really request if you can, everybody should participate in this webinar, in this poll. Great, very good. So by the meantime, we are live on the poll. So I would like to just continue a short discussion on the flow of the webinar. So really thank you all for taking the time to participate in this virtual CME. So we received more than 1,453 registrations, and I'm really grateful for all your support and participation. And I'm super glad to share with you all that we have collaborated with Nature Fit. So Nature Fit is the first app-based digital platform that brings you goodness and wellness of Ayush. It is the ecosystem based on the concept of Heal, Shop, and Connect. Heal is a digital clinic for more than 3,500 plus Ayush practitioners pan-India. whereas Shop with 100 plus brands is a marketplace for everybody, for everything natural to deliver prescriptions and natural products. Connect is a social platform for all Ayush believers with daily goals. Since its start, the platform has seen 18,000 plus users. Fantastic. 15 corporates, 3,500 plus doctors, and 110 plus brands associated with it. So the complete focus on helping people access Ayurveda is more in an easy, engaging manner. So let nature heal all. Fantastic. I'm glad to collaborate with NatureFit, and NatureFit is a very good initiative, fantastic platform. I hope you guys, everybody is aware of Karali Ayurvedic Group as well. So Karali Ayurvedic Group is a 111 years old Ayurvedic brand manufacturing more than 923 SKUs that comprise of traditional medicines, proprietary medicines, cosmetics, herbal teas, and many more. So we are also on a mission to spread Ayurveda across the globe. And I want you all to be part of this mission. And I would like to hear from you, see from you all that are you guys with us on a mission Ayurveda, spreading Ayurveda across the globe. So I would like to request everyone to type mission Ayurveda on the chat box. Great, very good. Dr. Shivani, Dr. Prerna, fantastic. I see a lot of participation and we are all on the same mission to spread Ayurveda across the globe. That's very good. So just to run through the entire flow of the webinar. So webinar will run till 5:30. Approximate, we are expecting the webinar will run till 5:30. Our speaker, Dr. Ram Manohar, will gonna speak about a wonderful topic on diabetes, a very insightful presentation on diabetes. We have Miss Avneet Bhatia. She will be talking about NatureFit. She is the founder of NatureFit. We will be having a Q&A session. Another exciting thing we're going to launch is a competition for all the doctors. A short, brief description about the products shared by Mr. Puneet Endle. And we're also going to announce some winners who will ask the best question, and also announcing the participation certificates to you all. So let's take this forward. I would like to welcome Dr. Sachin Rewar, who is the business consultant and Ayurvedic practitioner. He holds experience more than 20 years. And I would like to pass on to him, and he will take the webinar by introducing the speakers of the webinar. Doctor, over to you.
Thank you so much, Rishabh. And can we have that poll end, please?
Yeah, I've ended the poll, Doctor.
Okay. Thank you, Rishabh. Thank you. And so friends, welcome. Good afternoon to a very warm afternoon. And today we are here on this great platform to know and learn about the effective management of diabetes by a very, very well-known personality in the field of Ayurveda. You all are aware about him. Everyone knows about Dr. Vaidya P. Ramanoharji. He is such a personality that he doesn't need any kind of introduction. But still, I take on privilege, and let me not waste any time further because we are running short of time. So we have got two personalities in this webinar. One is Vaidya P. Ramanoharji and Miss Avneet, founder of NatureFit. So we have got two great personalities today here with us. So let me introduce Dr. Vaidya P. Ramanoharji. He has attained his Bachelor of Ayurvedic Medicine, that is BMS degree from Bharatiya University, Coimbatore, and postgraduate degree, that is MD, from RGUHS, Rajiv Gandhi University of Health Sciences, Bangalore. He is into Ayurveda research field since last 29 years. So we are very fortunate to have him on this platform because he's such a great research person in the field of Ayurveda. At present, he is serving as research director at Amrita School of Ayurveda. It's very renowned school of Ayurveda. Everyone knows about Amrita Vishwavidyapeetham. It's a deemed to be university. And let me take few seconds to announce one more thing. One of the Asia's biggest hospital is going to open at Faridabad, 2,000 bedded hospital from Amrita Group. So he is associated with that group as research director at Amrita School of Ayurveda. He had served as scientific advisory group of CCRAS, Central Council of Research in Ayurvedic Sciences, Government of India. He had been associated as faculty at several institutes of international recognition and has been imparting courses and training in Ayurveda like University of Essen, Germany, Southern California University of Health Sciences, United States of America, European Academy of Ayurveda, Germany, and Ayurvedic Point, Italy. He is an approved guide for the PhD program in Ayurveda at Amrita University, and he is as a research advisor for Indian National Science Academy, such a repeat organization, Indian National Science Academy, as research advisor to Government of India. He is member of the Scientific Committee of National Institute of Ayurveda, NIA, Jaipur. He is the member of the WHO expert, World Health Organization expert group for development of international standard terminology for Ayurveda. That means he is associated with defining the terminologies of Ayurveda at international level. He is in the task force of interdisciplinary research in Ayurveda for COVID-19, Ministry of Ayush, as well as Kerala State Task Force for Ayurveda Intervention COVID-19. For the effective management of COVID-19 through allied sciences, specifically through Ayurveda, he is associated with central government as well as the government of Kerala State. He served as CCIM, the Central Council of Indian Medicine, Government of India, as a member of CCIM, and also in Scientific Committee of Central Council of Research in Ayurveda Sciences, Government of India. He is member of Advisory Board of Central Sanskrit University and member of Working Group to formulate educational policies for integrative medicines. Niti Ayog, it's a very prestigious position of Niti Ayog. As a member of Niti Ayog, who is formulating the educational policies for integrative medicines. As well as he was the principal investigator on the Indian side of the National Institute of Health, US, United States of America, had sponsored research study to scientifically evaluate the efficacy of Ayurveda with respect to rheumatoid arthritis. So there was two teams. One was from the Western countries, and another team was from the from India. So he was the principal investigator of the team and had conducted in collaboration with the University of Washington, Seattle, and University of California, Los Angeles, and AVP Coimbatore under the leadership of Mr. Daniel First, MD, eminent rheumatologist. This study was published in Annals of Rheumatic Diseases and Journal of Clinical Rheumatology and had won the prestigious Excellence in Integrative Medical Research Award, that is IMRA award, from the European Society of Integrative Medicine. So he is such a well-known personality. He has spearheaded the clinical documentation program called as Rudra and also established the first online indexing service for Ayurveda research papers called Dhara. He has served as principal investigator on projects granted by the Department of Ayush, Indian National Science Academy, and the Coconut Development Board, and had been associated and credited with more than 60 publications. See his research work. I mean, we have got such an eminent personality on board today, which had got credit of more than 60 publications, including research papers published in peer-reviewed indexed research journals, as well as contribution chapters of books. Under his editorial leadership, Ancient Science of Life became the largest PubMed indexed research journal in the field of Ayurveda. He serves in the editorial board of the Indian Journal of History of Science, published by the Indian National Science Academy, as well as he served as the chief editor of Abhinava Dhanvantari. He has participated and was invited as speaker in major international conferences as well as national conferences. He served twice in the communication committee of the international conferences on integrative medicine and health. My friends, the future of medicine is integrative medicine. So he had served twice in the communication committee of the International Conference of Integrative Medicine and Health held at Miami and Las Vegas in the year 2014, month May. and 2016. He also served as head of the scientific committee of International Network for Development of Research in Ayurveda, that is INDRA. The third meeting of which was held at Milan, Italy on 20th September 2016. And let's not forget to mention the accolades and awards, what he had achieved, what he had earned. He was honored with the Ayurveda Marga Pravartika Award by the L. Madhavans Ayurveda Foundation in 2014. And Vaidya Sundarlal Joshi, very prestigious award, Vaidya Sundarlal Joshi Smriti Shodha Puruskar by Maha Gujarat Medical Society in 2015. He also received the Bharadwaj Puruskar Award for Punotham Ayurveda Ashram in July 2016. In 2017, he was honored with the Dr. C. Dwarkanath Memorial Award by IASTAM in 2021. In 2021, he won the Keshav Baliram Hedgewar Healing Honor for contribution to integrative medicine. See, the list is very long. We have got such eminent personality today with us who had won the Bhishak Bhushanam Award from Vagbhata Sarani in 2021. He was co-author and PI on Indian side of the research study on rheumatoid arthritis, which was done in association with the European Society of Integrative Medicine in 2012. He had visited several countries on research projects and research visits to United States, United Kingdom, Canada, Germany, France, Netherlands, Italy, Austria, Latvia, Russia, Denmark, Belgium, Switzerland, Argentina, Brazil, Singapore, Thailand, and Sri Lanka, and many more, for the promotion of Ayurveda. So we have got such a personality today with us to guide us on effective management of diabetes. We all know about the diabetes. We all know about Prameha or Madhumeha. We all know how to treat diabetes and all. But there is some insight about the subject which we need a guide to guide us, which we need someone to guide us. And we are fortunate to have Dr. Ram Manoharji with us today, who will guide us for the effective management of diabetes through Ayurveda. And let me also take this opportunity on this platform to announce another webinar to be held later in this month. That webinar subject would be the continuation of this webinar, wherein we will have integrative dietetic management of Ayurveda by the concept of modern diet, nutrition, as well as Ayurvedic diet, that we will have later in this month with the blessing of Dr. Ram Manoharji. And another speaker today we have with us on this platform is Miss Avneet Bhatia, who is the CEO and founder of Nature Fit. And my friends, everyone, we all Ayurvedic physicians, doctors, we know about Nature Fit. By profession, she is an engineer, held a degree of MBA, and was alumni of IIT Bombay. She has an experience of 18 years of corporate work and was associated with international exposure with the names like British Telecom, Satyam, and Tech Mahindra. When she moved back to India, she was deeply impressed and deeply interested into holistic health, alternative therapies, leading to a yoga and naturopathy professional diploma. She earned that diploma with a goal to make Ayush Paddhati and natural therapies easily accessible, and to make it as the first choice for preventive and curative health. So my friends, let me take this opportunity to welcome both the eminent personalities, Dr. P. Ram Manoharji and Ms. Avneet Bhatia, to take on us further into the journey of this webinar. So let me call upon Dr. P. Ram Manohar sir to please guide us on the effective management of diabetes. Sir, please help us.
Namaste to everyone. And honored and consider it a privilege to be present here on this platform to share some of my insights on diabetes. I was myself, you know, diagnosed with pre-diabetes last year, and I can say that I was able to reverse it completely using natural methods and without using any pharmacological interventions. And of course, in the course of my clinical practice, I've had to also treat a lot of diabetic patients who come for other problems. But most people, today India is the diabetes capital of the world, and Kerala, especially within India, is emerging as a diabetes capital for the country. So this is a very common non-communicable disease. In fact, statistics show that 70% of mortality and morbidity in the whole world, 71% of deaths can be attributed to non-communicable diseases, of which we have heart disease, cardiovascular disease, leading it, then followed by cancer, then diabetes and also respiratory illnesses, are part of this. So this I think is a very good, area where Ayurveda can contribute. The 71% of the global disease burden is due to NCDs, and diabetes is one of them. And the world is looking at alternative approaches, and that is what I want to discuss today. What is the scope of Ayurveda? And based on my own experience and reading of the text, whatever I have learned, I will try to share. It may not be complete and the ultimate, but it's sharing, what I have learned in the course of my experience with this disease. So let me share my screen now. Please let me know if you're able to see the screen now.
Yes, doctor, we can see your screen.
Yes, sir. Yes, sir. You're able to see, sir.
Yes. So I just want to start by sharing a very interesting article that I found. Of course, it's a preprint, but it's a very interesting point to start our discussion today. This came on medRxiv, and it is, from August 2nd, just 2 days ago. And so I was intrigued that it is reflecting the same points that I wanted to discuss today in my talk. So I thought I'd as well start by referring to this new publication. So does sugar control arrest complications in type 2 diabetes? So examining rigor in statistical and causal inference in clinical trials. So for over the last many decades, since the discovery of insulin and methods to measure blood sugar, the whole focus on management of diabetes has been on controlling blood sugar. So we all have even these devices now with which we can measure blood sugar. And so glucose regulation is the main target of treatment for type 2 diabetes mellitus in clinical practice. So this paper is pointing out that what really is the evidence available to show that glucose normalization, how effective it is as a strategy to control diabetes, especially diabetes complications and mortality. So the authors are here pointing out that there are a lot of limitations. There needs to be alternative ways to develop targets for treatment of diabetes. And this overemphasis on just controlling sugar, of course we need to. When blood sugar rises to a crisis, then it can have consequences. So definitely we need to control it, but that cannot be the key focus in diabetes treatment to really improve quality of life, prevent complications and mortality from this disease. So the authors here are pointing out that we need to rethink about some of the fundamental beliefs about the pathophysiology of diabetic complications and novel alternative lines of research. And this, I think, sets a very beautiful stage for Ayurveda to come in with, the alternative ways in which we can look at diabetes. So even insulin, driver versus navigation causation in biology, the case of insulin and fasting glucose. So this overemphasis on also using glucose for controlling diabetes, again, it is necessary as an immediate management measure, but then we need in many patients in whom insulin is indicated. But over reliance on insulin is also creating a lot of problems, as you can see here. Long-term increased insulin raises your risk for breast, prostate, and colorectal cancer. So this rampant use of insulin is also creating new diseases and cancer. And there are clear indications that using more and more of insulin, which is the trend now, using more and more of medication and completely ignoring, the important changes that we need to bring about in our lifestyle habits, eating well, staying active, maintaining a healthy weight, which decreases actually not only the need, for insulin. So you can manage your diabetes with less insulin, which is a very important therapeutic goal, and with which you can not only reduce the complications from diabetes, but also the risk of other diseases that come from over reliance on pharmacological therapies. So with this introduction, I'd like to really highlight what I want to focus here today. In modern medicine, there is this shift now towards lifestyle management and healthy diet for diabetes. I'll be referring to a study that happened recently called the direct trial, in which it has been clearly established that by weight reduction as a major goal and lifestyle changes, people can completely reverse diabetes. While it is not possible pharmacologically to do this, for the first time we have clear evidence that diabetics, people who were even diabetic for 6 years, by changing their lifestyle, they could come back to a normal state. And this is extremely important, because this is the first time that diabetes is being looked at from this angle and an intervention has been developed. But the problem here is compliance. We all know that Dean Ornish was one of the first persons, a cardiologist in the US, who proved that even coronary artery disease could be reversed, which is not actually possible pharmacologically, where you have to do surgeries, bypasses, or stents, and we know all of them have limitations. Dean Ornish proved that through a very stringent diet and lifestyle program, the blockages in the coronary vessels could be reversed. So there is no doubt. Ayurveda also says pathe savi gadarthasya kim aushadha nishemani. When you follow proper pathya, what is the use of aushadha? Pathe asadi gadarthasya kim aushadha nishemani. If you don't follow pathya, then also what is the use of medicine? But that's not our problem. It is very difficult to get people to comply to such strict diets. And that's where I think Ayurveda comes in. Because in Ayurveda, we have said that pathyam should not be mentally stressing. And that's the problem today. And this is where I want to position Ayurveda for diabetes. Pathyam, pathonupedam yat yatchapi manasa priyam. When you give a pathya for a patient, it should be healthy medically, good for the srotases in the body. It should also be pleasant for the mind. Yachapi manasa priyam. Most of the diets that are successful today, which they have done studies, are very stringent. They can bring. I also did some experiments with diet, and once I got even an anxiety attack by trying to cut too much on my diet, foods that I usually used to enjoy. So food is also a support for the mind. So Ayurveda says food should be nutritious, it should be assimilable, and it should be delicious at the same time. This is the challenge of diet today. When you go by nutrition, we don't get all these three things together. So here, in my strong belief that Ayurveda can offer a more personalized dietary regime, a more personalized lifestyle regime that will not come with the stress that we see with the stringent diets that are applied by these studies and these findings. We can customize this diet according to the prakriti of the individual. We can customize the lifestyle according to the prakriti of the individual, and we can find a lot of ways. Ayurvedic cooking is actually a science because it has focused on bringing these three things together. Nutrition alone is not enough. Good nutrition, if it is not assimilated by your body, it is not useful. So it should be assimilable. And then it should also be delicious and tasty. So this gives us now a very big opportunity. So the point that I'm trying to make here is that we have to move from pharmacological treatment to a more lifestyle-based management. And this is where Ayurveda helps, because through customized lifestyle and dietary management, Ayurveda can lay the foundation for a more acceptable, personalized way of dealing with diabetes. And when it comes to pharmacology, you may ask, am I pointing out that we shouldn't have any medicines at all? No. This is also where Ayurveda has an advantage. Because in modern medicine, even from metformin, which they give for pre-diabetes, all of these are very interventional and are attended with a lot of side effects. So when they go to diet, recently we wanted to do a study on pre-diabetes, and the reviewers objected that in pre-diabetes we shouldn't give any medicines. We wanted to give some simple herbs like triphala or other simple herbal formulations. They are mistaking it as equivalent of modern pharmacological intervention. No, Ayurveda has an advantage that we can also add a lot of herbal formulations which are simple, which can be used, in our day-to-day life without the danger that is associated with the use of intense pharmacological, interventions. So this is where I think there is a gap. There is a need, there is a gap, and there is something that Ayurveda can offer. A combination of dietary, lifestyle, interventions supported by a lot of herbal formulations which we cannot say are very strong like the modern pharmaceutical interventions. So this is the point I want to make here today. So just a background, how serious this problem is. So India is the diabetes capital of the world, and this is really alarming that we are going to witness a 266% of rise in diabetes cases. We are expected to, host 69.9 million diabetics by 2025 and 80 million by 2030. I mean, this is not a small thing. And a state like Kerala, in some states it is even very high. The cumulative incidence of type 2 diabetes is 21%, but pre-diabetes cases are also increasing. It is becoming 36.7. So the conversion of pre-diabetics to diabetics is now, because everybody who gets pre-diabetes does not have to move on to diabetes. But we now realize that 60% is the conversion rate, that 60% of those who become diabetic are likely to become diabetic. So this is the problem here. So very large scale public health interventions are necessary. Diabetes is the new epidemic, and you can see the prevalence rate in India, Rajasthan. This is a place where the non-vegetarian diet is the least in India, and there seems to be some correlation. Kerala uses a lot of non-vegetarian. As you move from a vegetarian to a non-vegetarian spectrum, you can see the incidence of diabetes is greatly increasing. There's so many studies and data that show us that diet and lifestyle are clear drivers of incidence. So I want to also point out that as Ayurveda physicians, it's very, very much possible for us to catch diabetes in the pre-diabetic stage and offer a lot of alternatives which people can follow without much difficulty. And in this way, we could really prevent the conversion of the rising number of pre-diabetic patients in our country into full-blown diabetic. So this is one major opportunity that we have to, use to help, Indian society. So now, what is the scope? Structured interventions combining physical activity and modest weight loss. This has been well established to lower type 2 diabetes risk by up to 58%. Which means you can reduce the incidence of diabetes by up to 50%. These numbers are really very significant. I mean, if you can reduce the burden of diabetic patients by 58%, I mean, this is a huge contribution. And I strongly believe that Ayurveda can lead this fight against the diabetes epidemic. And Ayurveda has also prescribed physical activity for Kabaja type of diabetes, which is so relevant for pre-diabetes. So this direct trial showed that remission, not only we can achieve remission, we can sustain it if you follow a weight loss by diet and physical activity. And now the challenge for us is to how to convert this diet and physical activity and supplement it with herbs so that it doesn't become so difficult as it appears to be in all the studies that have conducted it. And this, I think, would be a great blessing for the people. Right. So now, before we get into the strategies, I want to just look at diabetes from an Ayurvedic perspective. So we know diabetes mellitus is described in Ayurveda under the group of diseases characterized by polyuria, and we call this as prabhuta avilamutratva. Samanyam lakshanam tesham prabhuta avilamutrata. So the excess urination and turbulence in the urine, these were actually the clinical signs today. And of course, the name Madhumeha means honey urine, and Prameha means Prakarshena Mehati or excess urination. So these were two major symptoms, and in Ayurveda we can see this progression. Urine, sugar is a later development in diabetes. So Prameha to Madhumeha is a whole spectrum, and we'll just try to see how Ayurveda understands it, so that we can see what is the alternative approach that Ayurveda offers to just insulin and blood sugar. What are the other drivers of diabetes, which if we target with our medication, we can bring longer, sustainable, and better outcomes in diabetes. So we know this is just a little history. Ayurveda, of course, described diabetes many centuries ago. And Madhumeha and diabetes mellitus seem to be translations of one another. Honey urine or Madhumeha is exactly the meaning of diabetes mellitus. This has also been, discussed by Greek physicians. But what is the big difference in modern medicine is that the concept of glycosuria, that honey urine or sugar in urine was recognized in ancient civilizations. But what modern medicine added to it is also the concept of glycosuria, that urine in blood. So that's a question I will ask. Did Ayurveda know about it? That's why I'm telling this history. What is the Ayurvedic understanding of glycosuria versus, urine sugar? Did we have an understanding of it? And if so, what is its significance? So in modern medicine, of course, we distinguish diabetes insipidus from diabetes mellitus. So what is the understanding of diabetes that Ayurveda offers, which is so critical for us to give an alternative, framework to deal with this disease? And what is the current status of research? These are the two things I would like to focus. And what is the practical scenario in practice? So Ayurveda texts are distinguishing between Prameha, which is polyuria basically, and Madhumeha with glycosuria. And Sushruta Samhita is very explicit. But there is a confusion. I'm sure as clinicians of Ayurveda, we have always faced this. I've also asked this question. Are the Pramehas in Ayurveda really, all of them, are they diabetes, or do they include other conditions like proteinuria, bilirubinuria, or retrograde ejaculation? All these things seem to be fitting into the 20 types of Pramehas that are mentioned in Ayurveda. So there is a confusion here. So we know that this is one question I'm asking, and I'll try to give my answer for that. 10 of the pramehas caused by kapha, 6 by pitta, 4 by vata. Some of these conditions mimic diseases that are not at all related to diabetes mellitus. So Udaga meha, for example, seem to correlate to diabetes insipidus. Haridra meha to bilirubinuria. Vasa meha could be proteinuria. So it looks like when they discuss prameha, they discuss also many other conditions in which excessive urination, polyuria could be a symptom. And then Madhumeha was distinguished as diabetes, which is probably why Sushruta discusses Madhumeha separately. But some of these things could also still be related with diabetes. For example, albuminuria is a known complication of diabetes mellitus. So probably that is the reason why all of these have been put together. So this is a question which I really do not have an answer yet, whether the 20 types of pramehas are really associate, all of them associated with diabetes mellitus. In my understanding, some of those conditions, the types of urination could be associated with diabetes, but some of them are, other conditions. But what we actually learn from Ayurveda with relation to diabetes and also the Tridoshi classification, I think that the Tridoshi classification of diabetes into Kapha, Pitta, and Vata is very relevant for diabetes mellitus itself. So I'm not going to answer the question about the 20 types of prameha, which is still not so very clear. All of them may not be related to diabetes mellitus. Some of them may be, like albuminuria and all that. But the classification of all pramehas into the Kapha, Pitta, and Vata types, I think, is extremely important for clinical practice. And this is one of the points I want to discuss today. When you see a diabetic patient, it's very, very helpful if we can do a dosha vikalpa. This is a unique advantage. This other classification of type 1 and type 2, you can see in Sushruta Samhita also, which is now considered very important clinical classification. Sushruta also mentions that two types of prameha, the Jata pramehi, or that is juvenile also is there, and then those of genetic origin inherited from the parents, and that which is called by faulty lifestyle. And prameha of genetic origin occurs in even lean individuals, and prameha from faulty lifestyle, obesity. So this is helpful. Pregnancy and diabetes has also been, correlated to some extent, where pregnant women who take excess of sweets are said to have a child who would also be born with diabetes. So those things are there. But so in Ayurveda, Madhumeha and Prameha seem to have been distinguished. And when the blood glucose level exceeds about 160 to 180 mg per BL, that is when, in the kidney begins to excrete glucose in the urine. So there is a history before that. So now my question is, how does Ayurveda classify diabetes? What is its clinical? This is a very good framework. For the Kapha Pramehi, we need a different treatment. For Pitta Pramehi, we need a different treatment. And I found this clinically so helpful. People who are coming from the Gulf and such places where they eat a lot of spicy, they are presenting with Prameha, which according to Ayurveda would be like a Pitta Prameha. Those people who are eating more Kapha type of foods, and when they get Prameha, it is more like a Kapha Prameha. So you can even trace the history of the diabetes and its clinical presentation to the dosha. And then we are able to use because this is a very different alternative to just using today. When we do research on Ayurveda, we are trying to see which drug has got hypoglycemic effect. Ayurvedic medicines don't work that way. When you deal with the dosha and the whole pathology, for a Kapha Pramehi, giving Kapha specifying medicines indicated in diabetes will achieve better glucose control. For a Pitta Pramehi, we give medicines that are for Pitta, then it works better. For Vata Prameha, it is difficult. According to Ayurveda, Vata Prameha is incurable. But still, today we have insulin, so they can take insulin. But along with that, if you give Ayurvedic treatment, we can reduce the dependence on insulin. And as I told you, this is a very important clinical target, because in the beginning, that's why I wanted to show that excess use of insulin is getting associated with higher incidence of certain types of cancer. So even you cannot say that just because there is insulin, I can keep taking shots of insulin and then do whatever I can do. That there also Ayurveda has a role. That is the scope for integration. So if you go from Kapha Prameha to Vata Prameha, in Kapha Prameha, it is the field of Ayurveda itself. It's better not to use medicines, no modern medicine. That direct trial has shown that people who take medicines instead of going for a lifestyle change, they become permanently diabetic. Whereas people who follow a lifestyle and alternative approach, they get cured of diabetes in the early stage. Whereas when you come to a Vata stage where it is insulin dependent, integrative approaches are relevant. So in this whole spectrum, when you bring the Ayurvedic narrative of diabetes, the whole picture changes. The attention moves from just blood glucose control, where modern medicine is best. If there is a hyperglycemic crisis, let us use modern medicines, but then start the Ayurvedic support, and we can help them to come out of it and also use it in a very minimal way. And these are very important therapeutic goals. So the three stages in progression of Prameha. While we cannot classify diabetes mellitus into the 20 types that Ayurvedic texts have mentioned. It's very easy to classify them into these three categories. This is a clinically relevant classification. And that's one thing which I learned from my clinical practice, which I want to share to this group. The kapha, when a patient, Prameha Rogi comes to us, check doshi classification. Kapha predominant stage is easily treatable. You can cure this type of prameha. So today people are making a lot of false claims. Ayurveda never said that prameha is anushangi. It is one of the maharogas which you have to live with. So prameho anushanginam, that is very clearly mentioned. Ayurveda does not make a claim that you can cure all types of diabetes. But one of the subtypes of diabetes, Ayurveda says we can cure. And modern medicine is also, with its new findings, are pointing out that that type of diabetes in that stage is reversible, and that is Kaphaja Prameha. Pitta Prameha can be managed. You can prevent its progression. You can prevent a Pitta Prameha Rogi from needing insulin. In many Pitta Prameha Rogis, you can even take them off modern medications. But we may not be able to. They may need a lot more restrictions, not like the Kapha. But they can still lead a good quality of life. But when it comes to a Vata dominant stage, Ayurveda says Sadhya Yapya Parityajya. The Vata type of Prameha is you forsake, you cannot treat. I mean, that's an extreme statement, but then they tell the treatments also that you can manage it. Today, with insulin, Vata type of Prameha, they have some hope, especially in the short run. But in the long run, it is with Ayurveda that they can also have better quality of life. So this classification gives us an opportunity to intervene in this whole spectrum of diabetes. So that's the first point that I'm going to make. Now, I want to say most of the Ayurveda clinicians today are wanting to follow the style of modern medicine. Prescribe one pill or some supplement, which we just pop that up and then your problem is solved. That's not the way Ayurveda works. We must understand that Ayurveda is a combination of counseling, diet, lifestyle, and medications, including surgery. Everything is there in Ayurveda. But the difference is in modern medicine, diet and lifestyle have to support pharmacological intervention. In Ayurveda, diet and lifestyle is the key intervention. Pharmacology is the support. If we bring that perspective, then we can change the whole way in so many diseases are treated. And I won't say that today it is difficult. I can see even in the place where I live, people are beginning to become aware of, how to make, they want to change their lifestyle. They want to control their diet. So many people are enrolling for, weight loss management programs. They are trying to do it their own way. They're becoming fitness freaks, as you can say, but they're overdoing things. You must have seen so many celebrities now who died, who were actually physically very fit. They're doing, many film actors and others. Recently, we had to witness those tragedies. This is because it is an imbalanced thing. They're going into too much of extreme. Whereas in Ayurveda, we have moderation. We don't have, many people think that in Ayurveda, diet and lifestyle means it's the end of your life. That is when Charaka Samhita, I thought at one point in my career that when I prescribe a diet, I must choose the most bitter food for my patient. It's like punishment. Ayurveda is not a sadistic approach. There is a saying in Ayurveda, pitta can be cured by sweetness. Why give bitter? So it is not that we have to make the life difficult for patients. That is where Ayurveda actually comes in. It is possible to make, I want to point out a sloka from Charaka Samhita, where Charaka clearly says, Satatyat swadva bhavadva pathyam dveshyatumagadam. If a patient is being given the same type of food, we say, okay, keep taking millets. After a few days, the patient thinking of millet will vomit. Satatyat. If you keep asking a person to have a monotonous diet, that Ayurveda says will cause stress and mental disease. Swadva bhavadva, if it is not tasty. Food is very nutritious, but this patient just cannot tolerate that food. Pathyam dveshyatvam agadam. What Charaka says, change it. Kalpana vidhivistaisai priyatvam gamayet pada. If you don't make your food tasty for the patient, then forget it. You are actually increasing the disease. Manasaha arthanukulyadhi tushtirurja balodaya. When the mind is happy and pleasant, your immune system is activated, the disease comes down. So food, tasty food. This I want to emphasize. If in Ayurveda, if we want to promote Ayurvedic diet and lifestyle, We must really bring this new narrative that Ayurvedic foods and diets can be tasty. And that is the whole Ahara Vidhi or Paga Vidhi. In India, kings used to be cooks. Cooking was considered a very prestigious thing. Males used to be cooks. The most beautiful treatise on ancient Indian cooking is by King Nala. It is called Paka Darpana. It is a king who wrote that. And there's so many recipes because this whole idea of how to make food tasty, nutritious, and assimilable. That is the whole thing. And that we have to bring in here. So Ayurveda has talked about a lot of things like related to lifestyle, Asya Sukham, sitting for long hours, Swapna Sukham, excessive sleep, eating a lot of curds and similar substances, meat of domestic. You can see already, you have seen from Rajasthan to Kerala, the whole incidence of diabetes, the least in Rajasthan, which is the most vegetarian state in the country. Rajasthan, Gujarat. If you look at the whole map of India, as you move towards the non-vegetarian eating region, you can see a sudden spike in the increase of diabetes. So all this has been very clearly mentioned in Ayurveda. Fresh grains, Guda Vaigratham. So now this is again a new finding. I think as Ayurveda clinicians, Asya Sukham, I want to show how Ayurveda anticipated. Today, sitting is considered the new smoking. This is a new statement. Even you smoke, you will live longer than if you sit. If you are going to sit for 9-10 hours in a day, even if you try to compensate it by exercise, it's not going to be compensated. This is the most frightening finding. Diseases like cancer, diabetes, cardiovascular disease, they're all linked to just sitting. And this one thing, when you come to diabetes, the first cause Ayurveda says is Asya Sukha. So if you want to sit in like a yogi, because asanam and asya sukham are different. If you sit in a yoga pose, then you can sit sthira sukham asana. You can sit as long as you want because the flow of prana is not obstructed when you sit in a yogic pose. That is why in ancient days they did not make these comfortable chairs and tables. They used to sit, in sukhasana or padmasana and then do their work when they wanted to sit. So there are many interesting things, many things which we should actually have movement breaks. The actual studies indicate that you shouldn't sit for more than half an hour at a time. But at least for 90 minutes or 2 hours, if you have a movement break, you can bring these things. This will make a very big difference in the way, we prevent such diseases. So now, this is what I want to point out. If you look at this whole diabetic spectrum in Ayurveda, we have these prodromal kapha, pitta, vata, and complications framework. And based on this, we can develop very clear treatment protocols, which is not just focusing on controlling blood sugar. Controlling blood sugar will be a secondary outcome. I now have a patient here who came here, just 2 weeks ago with a HbA1c of nearly 10 and very high, fasting. And now yesterday we did not give any anti-hyperglycemic agents. We just did focus on kapha specification, Medas control, as I will tell Cleda. These are the pharmacological interventions that we give. None of them are anti-hyperglycemic. Yesterday, she has a blood sugar level, fasting blood sugar level of 95 and a postprandial of 157, which used to be 280, 232 fasting and 280 or something postprandial. It was very high. So I've seen in my clinical practice that if there is a crisis, if there is a hyperglycemic crisis, I have not been able to control it with Ayurveda. So that is where we may need, a quick intervention. But in all other cases, when you have time, if you have 2 weeks, 3 weeks to control it, you can definitely see that if you follow this framework, you can bring the glucose under control. But the dosha vikalpa is really very, very important. Now, another important point is about this glucose-urea and glycosuria and then blood, urine blood. Did Ayurveda understand this? Many of the prodromal stage symptoms, again, since we are all Ayurveda practitioners, I hope all are mainly Ayurveda practitioners, am I right? So as a student, we may have had a doubt. The prodromal symptoms mentioned in diabetes actually seem to be symptoms of complications and full-blown diabetes. For example, one of the key symptoms of diabetes going to manifest, I think somebody's mic is on, there is some disturbance. for diabetes, Mutre bidhavanti pipilikacha, that ants come into the urine. Now, this is urine sugar. Urine sugar is actually a very advanced stage of diabetes, not a premonitory stage. So we have always wondered why in Ayurveda this has been mentioned. So these symptoms are on the whole spectrum. All of them may not be seen in the beginning of diabetes. It is also because Ayurvedic texts say that sometimes diabetes is discovered only, it is discovered very late. And that is why some of the premonitory symptoms are mentioned. Right. So now I want to highlight here now what should be our therapeutic strategy. So apart from the blood sugar thing, what is it that we must target in Ayurveda? So, and this is what I have also found clinically in Ayurveda, this is a metabolic disease. And the metabolic factors that are involved in diabetes are kapha, medas, and then kleda. So all the Ayurvedic medications that we are using in diabetes, earlier I mentioned that we need to understand whether a patient coming before you is kaphaja, paitika, or vatika. That in all these conditions, better long-term sugar control is achieved when we focus on kapha, medas, and kleda. If we are giving medicines that target kapha, medas, and kleda, then in my experience, we are able to get a lot of interesting outcomes. Not only does the blood sugar control become better, but even the damage to organs can be prevented. So if you look at a framework where we can see both modern and Ayurvedic Prameha concordance, we can say Krisha Prameha is type 1 diabetes, Thula Prameha is type 2, then we have Jata Prameha and Jadottara adult onset, and then we have Kapha, Pitta, and Vata. And this, in my understanding, Kapha type of diabetes is a stage of insulin resistance. Pitta type is insulin deficiency and Vata type is insulin dependency, broadly. But we cannot, in my experience, we cannot identify or diagnose just on the basis of insulin. We have to look for Kapha, Pitta, and Vata Lakshana. These are very clearly seen in the patient. If you really look for, yeah, I can see already a lot of questions, but we will do that. Yes, I'm coming to why there is kleda. So kapha, medas, and kleda is the focus. And this is where I want to say Ayurveda is distinguished between tanu madhuryam and mutra madhuryam. So blood sugar in Ayurveda, there is a term, this is mentioned in Ashtanga Hridaya Vagpada as tanu madhurya, sweetness of the body, sugar in the blood, and mutra madhurya, which is sweetness of sugar in urine. So it is very interesting to say that Ayurveda has a much earlier discovery of this distinction between. So why does kapha, medas, and kleda play an important role in prameha? And that is because in the evolution of prameha, rasa dhatu is predominantly involved. And this is giving us a very important clue in an Ayurvedic approach to the development of diabetes. So rasa dhatu, rasa chaujas sankhya. Amongst the dushyas of prameha, somebody asked that question I just saw in the chat box. What is the role of kleda in diabetes? The role of kleda is coming because of rasa dhatu. From rasa dhatu is a very kapha dominant dhatu. Kapha gunas are predominant and it is in a drava rupa. And so this damage to the rasa dhatu results in kapha vriddhi, medo vriddhi, as well as kleda vriddhi. Now these are technical terms in Ayurveda, and in the limited time that we have, I have to move a little faster. So I hope everybody is familiar with these terms. Now, kapha is the mala of rasa. So at the level of dhatu, rasa dhatu is getting converted into medas. Rasa dhatu is associated with kleda. It is from the rasa dhatu that the kleda comes out in the form of kapha. And rasa dhatu is also considered to be the ojas, rasatmakam vahantyoja. So many things happen in diabetes because of rasa dhatu dushti. And when Rasa Dhatu is not properly transformed, that is when it causes accumulation of kapha, medas, and kleda. So, in my understanding, when in my experience, targeting Rasa Dhatu Shuddhi, the parinama of Rasa Dhatu, is helping us to really, target the key metabolic process, pathological process of when it is not enough to just target medas or just target kapha. If how do we target kapha? By reducing weight. If you do a weight loss program, definitely diabetes will come down. I was 95 kilos, now I am 75, 20 kilos, and within 6 months, I had just developed pre-diabetes. 6.4 was my HbA1c. It came down to 5.5, 5.4, and it has remained stable since then. So just weight reduction, reduction of kapha, and then medas. Today we can measure dushta medas by many, visceral fat, some of the scales that we use. So we need to distinguish. Many people may have normal weight, but they may have visceral fat, or near normal weight but visceral fat. Now you have to work on that visceral fat also, which is abadham, abadha medas. Ayurveda is clearly linked with prameha. As long as you have dushta medas, you cannot control your prameha. And then there is the kleda. It is that excess kleda which, according to Ayurveda, damages the kidneys, damages the eyes, damages the blood vessels. That excess kleda, whatever we may call it, these are called as glycated proteins and so many things that are circulating, causing microvascular damage. That microvascular damage is caused by the kleda in the system. And ojas comes down, the energy goes down, because rasa is that which supplies glucose and all that comes within the purview of rasa. So in Ayurveda, when we look at rasa, when we target the rasa dhatu, then we can target the entire dosha dushyas which are involved with prameha. We can control kapha better. If you control only kapha, medas, or kleda, you get results which are good but not very complete. But when you target rasa dhatu, then you have a very complete result. You can control all these parameters, and blood sugar also comes into control. And because kleda, medas, all these are involved with the complications of diabetes, the chances of the patient developing complications also comes down. So this is the key point I want to point out here. So this is how rasa chaujas sankhyada, rasa known as ojas, is said to be the dushya in prameha. So kapha becomes ahara rasa, and from this ahara rasa, kleda is formed. Now, when we are looking at the blood glucose levels, I can tell you we can interpret it Ayurvedically. So when we are looking at the postprandial glucose, we are actually looking at the glycemic load from food. So the glycemic load from food is the ahara rasa. The ahara rasa status is what we are checking by postprandial glucose. The sthayi rasa, because the fasting glucose is actually the sthayi rasa. So what we are getting an indication of by doing a fasting glucose checking is sthayi rasa. And random glucose level is the asthayi rasa. So if you look at the modern testing of glucose, fasting, random, and PPDS, you can clearly correlate it with these fractions of rasa dhatu. And that is why I found when we do, I have found Amrudottaram Kashayam, which causes rasa dhatu pachana. Haritaki, Guduchi, and Shunti. None of them are directly anti-diabetic. Of course, Guduchi is attributed there. They are not. None of these herbs are working by just bringing down the blood sugar suddenly. These herbs are working by purifying the ama in the rasa dhatu. And when the ama in the rasa dhatu is purified, in some patients where I have found this indication, or I have treated the patient for some other condition, they came with diabetes, this I have observed. By giving Amrudottaram Kashayam and that ama pachanam, I found their glucose levels have come down. So there is more to the management of diabetes than just focusing on the glucose. And Ayurveda offers these parameters. And I'm sure as Ayurvedic physicians, you know how to deal with kleda, kapha, rasa dhatu, and ojas, medas. And when the rasa dhatu parinama is happening properly, then there is ojas. The parinama creates ojas, and if the parinama is not happening, it produces medas. So this is a very very interesting pathophysiology of diabetes that Charaka Samhita presents, which gives us a new framework and a new target to deal with diabetes, apart from this focus on glucose. So rasa itself is a ojas or energy currency. So when you say rasatmakam ojas, it also correlates with glucose because glucose is the energy supplying thing. And in prameha, patients become fatigued because they don't receive this energy. So in Ayurveda, we have concepts of glycemic index of foods. We say lakhu santarpana, easy to digest, fast absorption, high calories. All foods have been categorized into four. Lakhu santarpana, guru santarpana, lakhu apatarpana, guru apatarpana. And Ayurveda tells once you classify foods into these four categories, you can choose the one. Like if you want in a diabetic patient low glycemic foods, but you need nutrition, then you can choose guru santarpana. If you want a patient to have low calories, but easy to digest, fast absorption, you can use lakhu apatarpana. So this is another framework which I found when I'm giving diet to the patients. I'm using this framework to classify all the foods into these four categories. Then according to each patient, guru santarpana is something which we have to really avoid in all diabetic patients. The other three we can use very judiciously. So this is again a very interesting framework. Now in Ayurveda, I don't know how many of you are trying this treatment procedures are very helpful. Some shodhana, some shamana, brahmana and rasayana, all the four we must achieve in prameha in stages. It's not or just about taking a few herbs, and checking whether your blood sugar is under control. There is a condition for shodhana in diabetes. When I started my pre-diabetic treatment, considering the kapha involvement, I started with Vama and I did Virechana. And that itself, even before weight loss was obtained, there was a drastic reduction in the blood sugar. Because in the mornings, it always used to be 110, in the pre-diabetic level. But after the Vamana and Virechana, the sugar levels came down to below 100. Coming to 90, 95, and as the weight loss also progressed, it came to 80s, and then it has stabilized there. So Samshodhana is also something which we must include into our package. But again, depending on the dosha vikalpa, because for the kleda removal also Samshodhana is actually very helpful. So in patients, when we Yeah, there are again other questions. I'm very tempted to answer them, but for lack of time, I will not do that now about Ojo Meha. Yeah, many of these lakshanas we can see, as I told you, some of the 20 types of pramehas are seen associated in diabetes mellitus also. That is why probably they mix them together. But all of them may not be seen, like Haridra Meham and all that may not be seen. Ojo Meha, and this Vasameha, conditions like proteinuria, they may be seen. Some conditions like ketosis, complications of diabetes, in that condition also kidney function is impaired. So you can see some of those problems may be related to diabetic nephropathy, which they have mentioned in the 20 pramehas. When there is kidney failure, or at much later stages when there is urine leakage due to complications of diabetes. But what I have understood is that even though we are not always able to clinically identify all the 20 pramehas, Vata Pitta Kapha classification with this focus on Rasa, Medas, Kapha and Kleda with Rasa at the center, this is giving a very effective framework. And this is very clearly visible in our clinical practice. And then, at a certain stage, we need to do Brahmana also. This is the beauty of Ayurveda. At the right stage, the right medicine. There is a medicine called Dhanvantaram Ghridam, which is a ghee. And when you say ghee, every diabetic patient is, getting afraid. I mean, ghee is all fat and, how can you? But Dhanvantaram Ghridam is mentioned in diabetes for conditions like diabetic neuropathy and where there the Vata Vriddhi Lakshanas are seen. The judicious use of ghee is very helpful. So if it is a Vata Prameha and if the condition is indicating, we can give ghee also in diabetes. This is my experience and understanding. So we need to bring this fourfold framework also. Our treatment should include the strategy of Samshodhana, Samshamana, Brahmana, and then at the right stage, we have to give Rasayana. Shilajadu is a beautiful Rasayana for prameha, but unless it is used at the right stage, it will not give result. So this using the right medicine in the right stage is another important factor. We may say Shilajaju is good, and when any diabetic patient come, you add one Shilajaju. That's not the way it works. If you do the Samshodhana, Samshamana, Brahmana, and then introduce Shilajaju, the findings will be really very dramatic. So this is the clear point I want to make today, that we can consider diabetes mellitus as caused by the habitual formation of rasa shesha jirna, excess accumulation of ahara rasa and asthai rasa due to faulty diet and lifestyle. So fasting and physical activity are the remedies for eliminating rasa shesha jirna. Then we have a lot of medications also which can deal with Rasa Shesha Jirna. And if we are treating the patient by targeting Rasa Shesha Jirna, I think the clinical outcomes are excellent. Because Rasa Shesha Jirna is exactly what we see as postprandial glucose level, or fasting glucose level, random glucose level. Because from the Rasa Dhatu, the glucose is not being utilized by the system. This is a kind of ajirna in the Rasa Dhatu. So the focus is on Rasa Dhatu and Metho Dhatu. The interventions that can eliminate Rasa Shesha Jirna and break down Medas are helpful in the treatment of diabetes. And this is why our medicines like Asanadi, or Asana, which is a very good Medohara Dravya, then Kabhara Dravya like Triphala, which is very Kleda removing. So when we use Triphala, the Kleda and Kapha is removed, but it can increase Rukshada in the system. So picking up any one of these medicines and making it into just a single package for Prameha will not work. In my opinion, we have to actually have a whole algorithm of treatment, which will include, and that we can try to minimize and simplify. But if you forget this dosha classification, if you forget this targeting on the dhatus and the malas, the kleda and the meda, and if you don't think about treating diabetes in stages, then I don't think we can bring optimal, outcomes with diabetes. So, and what is interesting here is today only a fraction of the treatment methods mentioned in the classical texts are actually used in clinical practice. And so if we bring this treatment framework, we get a lot of flexibility, a lot of options for treating different diabetic patients in different ways. So this is then the more, clarified framework looking at constitution and other factors. Ayurveda gives us another framework. And as I began in the beginning, glucose and insulin is not really the target. And this is the key point that I wanted to point out. So opportunities for treatment of diabetes include risk and susceptibility assessment, pre-diabetic stage, diabetes mellitus pitta stage, vata stage, complications, macrovascular, microvascular, and then interactions and collaborative medicine. So this is the overall scope. For want of time, I cannot go into the details of all this. Today, this is more like an introductory, section, because unless the framework is explained, we cannot discuss further. So I'm unable to go into the details of all these possible areas where with Ayurveda we can intervene. So some of the clinical goals that we can keep in diabetes is long-term control of blood sugar, stabilizing modern medications, including insulin. This is something seen in actual practice. People taking modern medicine still fluctuating blood sugar. When they start on an Ayurvedic regimen, blood sugar levels are stabilizing better. We may not be not able to completely withdraw modern medicine or insulin, but reduce it, and still they are having better control. And but one big challenge here is we need to have drug-herb interaction. Drug-herb interactions we need to study to do integrative medicine. That is a big challenge. We can wean off modern medications, diabetic gangrene, diabetic food. That area I have not had much experience. I'm more focused on pre-diabetes and diabetes as a comorbidity when treating other diseases. These are two areas where I have worked more. And then the micro and macrovascular complications. Generally, diabetic nephropathy is much more difficult to handle than other nephropathy due to other causes. So it is always good to take a preventive approach. Now we don't have, I think my time is up. So the next slide, I'd like to ask the organizers if I can use another 5 minutes to just quickly, show some interesting things and then conclude.
Sir, please continue, sir. Please continue.
Yeah. So now the problem is Ayurveda medicines for diabetes. There is a systematic review from the US. This was done as early as 2001. And their findings are that this is the sad part of it. All the concepts and points that I mentioned today, how Ayurveda talks about diabetes and how to treat it, none of them have been studied in actual research. This is actually the sad part of Ayurveda and diabetes. You can see everybody has been studying whether botanical therapy is going to help us to control blood sugar. This is the only thing that Ayurvedic diabetics research has been focusing on. So this is such a sad state of affairs. Are we looking at whether if you control, if you work on Rasadhatu, will blood sugar reduce? Why can't we do a study like that? If you reduce kapha and medas or give medicines which reduce kleda, will blood sugar also come down? Is that not a more Ayurvedic research question rather than picking up an Ayurvedic herb and just asking whether this will reduce blood sugar just like metformin? So, dear friends, I think we have been completely taken away by the modern management targets, clinical targets. We have been trying to just mimic what is being done in modern medicine, and we have forgotten that Ayurveda offers an entirely new perspective, which is not focused just on glucose control as a primary target. Glucose control becomes a secondary outcome when we target the primary drivers of diabetes, which is kapha, rasadhatu, and then kapha, medas, and kleda, with the background of the doshas, moving from kapha to pitta to vata. I think this offers an entirely new perspective to deal with diabetes. So, you can see here, what is there in Ayurveda and what did the research find out? Gymnema sylvaris. This is not even a major herb in Ayurveda. Coccinia indica, these are the herbs that people have done, spending crores of rupees, found out that the few herbs are there which, are second to modern medicines in controlling blood sugar, some moderate effect. So, 54 articles. Most of these trials do not have very good, quality also. They're not done very well. And all the medicines that we see here, like tulsi, fenugreek, gymnema, they are not the major medicines which clinicians are actually using in clinical practice. I have never used any of these herbs as the main drugs in my clinical practice. Wherever I am able to control diabetes, it is with other classical formulations, which we have not at all researched upon. So, okay. So this is that finding from type 2 diabetes, direct trial. It will be good. I'm just saying a few interesting things which you can follow up and read more. And so diabetes is now being increasingly recognized as a lifestyle disease. And this famous Finnish study, 5% weight loss, fat, 30% energy. This is a formula they have created for, reversing diabetes. This is a reversing diabetes study. And I'm sure with Ayurveda, we can create a much more easy formula, which will have diets which you like and herbs which you can use without putting so much of pressure and stress. You can still have your diabetes. I think that is, we are working on that. I've not yet developed the formula, but this is one of my areas where we are very much keen to offer something to society. And this is very much encouraged by studies like this, which already show that such diet and lifestyle can help. But with Ayurveda, we can take it to another level. So Ayurveda also clearly said, Mahasana, overeating, Atisnigdasana, over fat food, Atistulata, obesity, Mandotsahita, not, being active, Achankramana, not moving around, Braja, all these things are the driving factors of diabetes, even that day and even today. So how we can, address this and create a whole package is what, US study also found this. So now the problem is modern medicine is going to teach us all these things. That is going to be the sad part of it is Ayurveda which should have led such studies. But I felt so much pain that if a direct trial had to happen in the UK and they are proving Ayurveda concepts but no mention of Ayurveda at all. Ayurveda was the first system to talk about this, but now it has been proven by modern diabetology. So adding either not being overweight or not having a large waist, this reduces diabetes. So there are many such factors. So I wanted to show a few other things. There are many, D-plan initiatives, diabetes in Europe, prevention using lifestyle, physical activity, nutrition intervention. This is a framework. Now, D-plan, I'm really looking forward. We are already working on it. We are doing some pilot studies to offer an IU plan for diabetes. I mean, it's very much possible. We must come up with that. People are now not coming with one medicine for diabetes. It is a whole plan. And how to make that plan more compliant and more, patient friendly. That is the challenge today. And that is where I think IU plan for Ayurveda, IU diet plan, something like that we could formulate, and that would be the intervention of the future to, handle the diabetes epidemic. Now, so many things are coming, toolkit for diabetes prevention. And I don't know how many of you know that, okay, these are some diabetes. So there is a strong dose response effect for those who adapted 4 or 5 lifestyle changes. Now, these are for people, if you cannot take up all the lifestyle changes, identify the key things. Don't sit for this time. Or, give them very simple goals. That itself as really reduces the progression. These are fascinating things. So you don't have to give a package that is so strict. You can even ask them, you want a diabetes, progression prevention package? Then you can have a simple lifestyle. If you want a diabetes reversal package, it is more strict. So people can have choices, This is what modern research is pointing out to. And I see a lot of possibility for Ayurveda with its concepts to make this more interesting, more user-friendly, and bringing in herbs and other support, making the effects more faster and quicker. Now, I want to show there are this I think all Ayurveda clinicians should use. Finnish diabetes risk score is it's very widely used. There is a simple, scoring system. And I'm running through this. There are many nutritional guidelines and all that. Eat Clever. This is, again, we can create acronyms like this. Eat Clever is a very interesting acronym. I will share this slides if you are interested so the readers can read those other portions more clearly. So the key point is that Ayurveda can fine-tune the diet and lifestyle and value add it with the pharmacological interventions with the focus on kapha, medas, kleda, rasa dhatu, rasa shesha jirna, and the tridoshi classification. I think that is the future for, and yeah, so, right. Yeah, there are many studies which also show the Ayurvedic 2-day timing, meal timing, eating a heavy meal in the morning, light meal in the evening, which Ayurveda says, which is preventing kleda. And studies have shown that eating 2 large meals a day help you lose more weight. And even for diabetics, it is achieving better control. Earlier, people were saying that diabetics should eat little, many times a day. But now new studies are showing that eating 2 meals a day, a larger meal in the morning and a smaller meal in the evening, earlier, this can completely change your metabolism. The whole metabolic abnormalities are reversed much faster. So many things are there. And yeah. Yes. See here, challenges in research, only 21 clinical studies and 19 clinical trials out of 660 citations in PubMed. Most of the things have gone in pre-clinical studies on rats and, that you're reducing sugar, nothing translated clinically. Although there are 245 related to humans, clear clinical studies are very minimal. So this is also a research gap. So I strongly suggest that because we need large studies, if clinicians come forward, start giving a new perspective, instead of glucose as a target, do more clinical trials where we can show that better control can be achieved. There is definitely scope for that. So whole system, using Ayurveda as a whole, there's only one study. All others are on single herb. Okay, so yeah, here is a study which shows limited evidence shows that some herbs and formulas have glucose lowering effects. That is the conclusion from all research today. This is a very sad thing. as if Ayurveda can only offer something just for glucose control. Whereas from my discussion, I hope I was able to convey that Ayurvedic focuses on the whole pathophysiology of diabetes, not just on glucose control. And bringing that into research is also our response. And finally, there is also something called as IDRS. I missed to put this in the trial. I don't know how many of you have heard of that. Indian Diabetes Risk Score. Please try to check that out. Somehow I missed putting that in the slide. I was advancing the slides to show that we have IDRS, which is a very simple questionnaire. And if you use that in all your patients, we are doing that in all our patients. Whoever comes to our clinic, we check what is the risk for diabetes. And if you find them at high risk, we can already give them a very nice regimen, simple, home remedies and herbs, which can help them to prevent them from progressing into diabetes. And that way, as Ayurveda clinicians, we can, put an end to the epidemic of diabetes, this huge threat that we see in the future. So with this, I conclude. I know that I couldn't cover everything, and I couldn't go deep into many concepts that I mentioned, but there is a limitation of time. Already we started a little late, so I took the liberty of covering up for that lost time. But now my time is up. Thank you very much. I hope this triggered some new thinking and thought in our fight against diabetes. Thank you very much.
Thank you so much, sir, for such a great insight on the subject. And my friends, I'm really fortunate that we had Dr. Ram Manoharji on this platform, who gave such a wonderful insight on the subject of management. Rather than management, the understanding of diabetes. Because once we are able to understand, then there would be a scope of understanding, or rather researching the management, effective management in terms of doshic, like what he said, like kapha. I mean, this is a new concept which I understood today. Like insulin resistance, we can take it as kaphaja prameha. Insulin deficiency, we can consider it as pittaja prameha. It's really, it's wonderful. It will help us in clinical management of the system. I mean, of the disease. Thereafter, with his talks and jo unhone kaha, it was really interesting that by means of dietetics, by means of ahar, I will just, with your permission, with the permission of Ramanohar sir, with his blessings, there are the Trayo Upastamba, we should not forget about Trayo Upastamba, ahara, nidra, and brahmacharya. Instead of brahmacharya, today we can take it as vyayam. Ahara, nidra, and vyayam. These are the three pillars of life. And diabetes is a lifestyle disease. And mother of every lifestyle disease, I may be wrong, sir, please correct me if I'm wrong. The mother of, or precursor of all lifestyle diseases is obesity, or increased BMI, rather we can say, but in today's terminology, BMI, or the waist circumference, or sedentary. Asya sukham, sapna sukham. This was considered as the disease of kings. Now we are kings in today's era. We are the kings. Previously, there were very few kings. Now everyone is king. We have got so much of resources to enjoy, and those resources are somewhere and somewhat they are having ill effect on our health. So I'm really thankful, and we are honored to have Dr. Ram Manoharji, who had clearly and cleared the concepts of kleda, rasa, kapha, meda. Once we are able to manage the kleda, the next topic of our webinar held to be scheduled to be held in the next, at the end of this month, would be on this same subject, like ahara integrative dietetics with the modern dietetic concepts and Ayurvedic ahara, that is pathya apatya. How do we manage to shoshan of this kleda, meda, and kapha management? And I would definitely approach sir for his blessings, because without his guidance, it would not be possible to go for that. So thank you very much, sir. Thank you so much. And friends, I request you all, whatsoever doubt you have, this is a golden opportunity. Whatsoever doubts you have on the management, for the understanding or the management of diabetes or prameya or madhumeh, whatever you may call it, please feel free to put your questions. we would be happy to ask to request sir to guide us on this, and we will take this. I would request Miss Avneet ji, the CEO of Nature Fit Company, and the company is working very well. I mean, it's wonderful, wonderfully for the upliftment of Ayurveda. So I would, meanwhile, we will have the session of Ms. Amnir and you can put your questions also. So let me take an opportunity to call upon Ms. Amnir Bhatia ji. Please come and take on this stage, please.
Yeah, thank you so much, Dr. Sachin, and thank you, Dr. Manohar. It was a wonderful session. Being a non-doctor, I have heard everything, and I could, interpret a lot of the things that you said, and very practical approach to looking at diabetes, very different and very interesting, and like modern medicine focusing only on symptoms, which you said rightly, whereas we look at the root cause of the whole why diabetes and try to treat it from there. So definitely thank you so much for those insights. And now we have, so all the doctors who are here, they have got those insights of how to treat their patients, or framework for diabetes, and I think that is their forte. So their forte is to have their knowledge updated about able to treat their patients in the best possible way. But there are few things which you require as doctors to grow your practice, to make sure that more and more people know about you, and but that is not your forte, and you do not have the time and the energy to focus on that, and that is where Nature Fit comes in, a very handy for all the Ayurveda practitioners, where we are helping you to digitalize and grow your Ayurveda practice. So we are here to take care of two major pain points of all the Vedyas. The first being more and more patients and more people to know about you and about your practice, about your credentials. And the second part is to manage your existing patients, managing your existing practice in a very digitalized way, in a very efficient way. So these are the two things that we will be talking about. I'm sure we all are proud to be a part of a sunshine sector, which is Ayush now. And thanks to the government, there are so many initiatives that have been taken in the recent past and, continuously being taken. And we all should be looking at the exponential growth that this Ayush sector is going to, envision. And we all should be riding on it. The second thing which is actually happening all across us is digitalization. We all know the pandemic has actually taught us the benefits of digitalization. We should understand that in today's world, 90% of the patients are searching you online. Even if somebody has referred to a doctor, the first thing a particular person or a patient does is search about you, and then he is going to go and visit you or take the consultation. So 90% of the patients are searching, and 70% or 60 to 70% of the consultations are now happening online. So for all the Vedyas, you need to be digitally very active and very present. Your presence should be felt by the patients, that yes, when they see about you, they are able to read a lot of your credentials, about what you have been doing, about your research papers, and that is where they are getting more credibility, that yes, I can go and visit this doctor and I'm sure of being healed by this doctor. Definitely a lot of your videos, a lot of your content is what people are seeing even before they reach to you. So now, what is Nature Fit? Nature Fit is the first Ayush digital platform where we have aggregated, and the concept is heal, shop, and connect. Heal is the nearest Ayush practitioner. Wherever the patient is, he is able to find the nearest Ayush practitioner, the Ayurveda doctor. He is able to read and know about them. They can book a consultation with them. As soon as the consultation is booked, we start asking Ahar, Vihar, Prakriti from the patient. If the patient is not tech savvy and not able to fill all of that data, even the doctor, while he's doing the consultation, we allow him to capture the Ahar, Vihar, Prakriti, the general, your BMI, fat, all of that can be captured on the app by the doctor or by the patient. So that's, and shop, we have all the Ayurveda brands, we have all organic brands. So we are a marketplace where people can not only connect with you as a doctor, but they could even purchase products. And even if as a doctor you are prescribing products, we can ensure that we are shipping it across the country for you if you require that service. And we have a lot of preventive health tools on the platform like Prakriti, BMI, fat, which people could come and themselves analyze their baseline, their health parameters. So we are on a mission Ayurveda and mission Ayush. The whole objective is to ensure easy accessibility to natural healing and to ensure good quality treatment and intervention. So we are trying to standardize a lot of these offerings through the platform. Benefits of digitalization, as we rightly said, there are two benefits, or we have to kind of ride the digital wave today. One is definitely for you to get more and more patients, to build yourself as a brand, to be known to anybody who searches for you or searches for a near Ayurveda practitioner. You should be available there. And the second is to manage existing patients. So here we have created a software where we not only connect you to the new patients, but we are also helping you to increase the value or the life cycle value of your existing patients. And when I show you the software, I'll just show you how you can do that. So there is one is like, I want more patients to consult me, and one is I want a single patient to consult me over a longer period. One, because all the Ayurvedic treatments, as we all understand, are not short-lived. They have their own, life cycle. And we as a practitioner, if we stay engaged with our patients, we are definitely able to give value not only to the patient, but there is an indirect value that we would also be getting because the patient is engaged with us for a longer time. So those are so how we can help. I will now right away take you to the, I'll take you to the actual platform where we can show you that what is that we have for all of you, all the doctors, how we will help you. We have this organic listing that you can create your profile on the platform. All patients nearby you can find you. Not only Indian but international patients can also get connected to you. There is a voice video clinic book appointment facility. You get new patients. We do a lot of health camps, a lot of activities around your location which you can participate in. We are dealing with a lot of corporates for their corporate wellness, and doctors can be a part on the panel for those corporates. So that is also a way we are trying to take Ayush not only to the direct customers, but we are trying to intervene into corporates and the knowledge workers as well. So these are this kind of activities we do. We do a lot of webinars, we do a lot of camps with corporates, we do a lot of camps with good residential societies as well. And these are the associations we already have. So these are the corporates which we are engaging on a very regular basis. So for some of them, we have got the corporate wellness. So it's a complete annual activity where on month we will be engaging with them, and we would be identifying the chronic patients of each of these corporates, and we would be connecting them to our doctors, the doctors who are on our panel, with the same fact that those patients would be going through modern medicine, but here we are trying to intervene, saying that we can help them by giving them an Ayurveda treatment where we could reverse or manage the chronic diseases in a better way. So these are the activities which we are doing. We have lot of influencers and other partners who help get the traction to the platform from the user perspective. So why we are telling you this as a doctor, because this platform will very soon start, it's already started attracting a lot of the users who are looking for Ayush or looking for Ayurveda. And very soon, with the kind of interaction we are having with the corporates, with the celebrity endorsements, we are going to get just see more and more footfall on our platform. So definitely a place for you to be, to have your profile created so that patients can get connected with you. So now I'll just stop this share and take you to the live platform where I could be able to share a bit more on just a second. Just give me a second, sorry. Yeah. Yeah, so this is the platform. So if anybody lands on NatureFit, this is what they see. So it's very clear when anybody lands on that, it's all about natural healing. It's about Ayurveda. It's about the Ayush therapies. These are the practitioners who are, so we have almost 3,000 plus practitioners already associated with us. Then we have a few health tools and calculators. We have a Prakriti based diet plan, which is indicative of favorable foods and all depending. So you could analyze your Prakriti and you could get certain recommendations on the basis of your Vata, Pitta, Kapha. So we have a lot of articles which we have, specifically for how Ayurveda can help in specific diseases. So this is how the whole platform looks like. This is the user side of the platform. So if anybody wants to, consult with a particular doctor, they could see the nearby doctor who are available. They could see their years of experience. They could see, and as I said, it's all not only Ayurveda, we do have homeopathy, yoga, and the Ayush as well. So this is your microsite. So when we say that you would like to create a profile, means you are having all your information with your OPD details, with your videos, with your images, and all of your clinic details and service on the platform. There could be the patient could look at that, he could read about you, and then he could decide to book a voice video or a clinic appointment. He could choose a date, he could choose, and all of this is something you can manage from your app or your backend. So this is how you could directly start getting people to know about you, patients to know about you and connect with you. Now, if we look at the doctor's side, so this is how a doctor's panel looks like. And this is how whatever the website which is seen on the patient side is what you can create on your own. So this is a complete software that we have given you. You could add your details. You can, just add your videos, services. You could change it on the go, just like you manage a Facebook or an Instagram is how you handle this particular platform. We have given you a questionnaire which we have prepared for the case analysis, which currently we have prepared, where we have an Ayurvedic parikshan and we have Prakriti analysis. But this questionnaire is something which you could change or modify. You could deactivate this questionnaire and you create your own questionnaire which you want the question, the data that you want to fill from by the patients. You could have it on this, and you can customize it according to you. You could change your timings, you can have your slots, and everything is something you can do it from the back end. Now, how does an appointment come and what all you can capture about a patient? So this is how an appointment is created. So as soon as somebody books an appointment from the front end, This is all you can get about the patient. So if there is a time that he has booked the appointment, if it is a video or a audio, the particular button at the time of the appointment gets activated. If it's a clinic appointment, then it will be a walk into the clinic. You have the provision to reschedule the appointment as well. Now comes the time that your patient has already reached the clinic, or you are doing an online consultation. You can start capturing everything about your patient on the app itself. So there is a lifestyle which we call the Ahar, Vihar. All of this is something which you can capture very easily on this platform, and then you could change the questions as per your requirement. This is something which you will always have. So the BMI, fat, his height, weight, his lifestyle, his food timings, exercise, all of this you will always have it with you for the patient. So this is something that you have kept for yourself. Now here another Ayurvedic parikshan that we have. Here also this is very simple to fill. So you are talking to the patient and you are just filling this data while you are speaking to the patient, or your assistant at the reception is doing so. And this is the Prakriti analysis that we have created for the patient. So this is all that you could upload a report as well, a medical report if required. And then once you have completed all the data, you can recheck and you can submit this. So this is how we have created a clear software for you, where you can actually manage your entire OPD practice at on your own in a very simple way. Now you can see that this is a little elaborate, but it is very easy once you get used to or doing it on the mobile app. So you have the web also and you have the app as well. You can add your own observation and diagnosis as a doctor. This data will not go to your patient. Then you have a prescription. So this is an interesting part which we have created, which I was talking about, the engagement. So you could put a follow-up date, you could put a medicine, you could put a medicine brand if you have. You can write how the intake, the dosage should be, Anupan. You can write a start date and you can write the number of days. Now, what you could do if you want the patient to get a reminder, instead of before meal and after meal, you can actually add a timing where you can say that at 10 o'clock and at 8 o'clock, the patient should get a reminder to eat the medicine. And this you could do, and you can also add certain additional notes, whether he has to do some yoga, some exercise, anything that you want, you could add it along with the medicine. You can add as many medicines you want, and you can add as many timing for a particular medicine. So that's something which is completely flexible. Also, if you don't want the patient to get this information, he can get the prescription as a link and he can just download it, and he might not require the app for the reminders. So app for the patient is only required if you want to engage with the patient on a regular basis. Otherwise, no need for the patient to have the app, and you could just have all the patient data at your end. So this is what we have created from the prescription part. And on the follow-up date, your patient will get a reminder a day before, and even you will get a reminder that it is time for following up. So this is how the engagement, the life cycle value of a single patient can also be increased by engaging with them on a very regular basis. So these are the features, and these are the things that we have created for you. And you could always send a patient a notification, a reminder kind of a thing. You can add your patients from back end. You don't need every patient to come from the front end, so you could really manage them from there. You have a complete patient history. So as many times the patient has visited you, all the details, what was the type of the appointment, was it created from the front end or was it created by you, and what is that you gave to him as a prescription, and what was the observation at that particular time. You can have all of it managed clearly here. So this is the complete engagement model or the software that we have created. So right from getting you new patients to know about you, and to managing your existing patients and increasing the life cycle value of them, is something that we have created on NatureFit. And we are proud that we are already having around 18 to 20,000 users, and we are associated with around 15 corporates whom we are doing wellness with. and a lot of other activities, and we have 100 plus natural brands, so Ayurvedic organic brands who are associated with us. So these are all the brands whose products are also available on NatureFit. So there is a very clear cross movement between the doctors, the products, and the engagement that we have created for the users in terms of knowing about them, their health, and all of that. So yeah, so that's about it. And we would love all the doctors who are attending the session today to at least start with getting their profile created on the platform, because that's the bare minimum you can increase your digital footprint with. And whoever wishes to associate with us on a larger way, where we could give them, make them a part of the corporate panels, or we can take them for webinars or some kind of additional interaction which the doctors would like to be done with NatureFit, they could get in touch with us and our team. Yeah. And for all the doctors who are there today, we are offering them a free profile creation and a 3-month subscription of the platform. Yeah. So thanks, and any questions you could ask me. Yeah. Thank you so much.
Well, thank you, Avneet ji, for such a wonderful insight on the company and its mode of function and the kind of services it is making available for all the doctors and as a whole Ayurveda community. So we are really thankful and we appreciate, and we would love to see you grow, the company to grow to beyond horizons and take Ayurveda to across the world, not only India, across the world, and help the people to explore and connect, help the people to connect with the Ayurveda doctors, physicians, companies, medicines, services. So we thank you and for this insight. Now, friends, so let's come back to the topic and say we have got almost 100 questions to be addressed by Ramanovar Sarji, but practically it will not be possible to address all the questions. So I myself have tried to compile few questions, and if at all, and I'm very sure that sir had already gone through all the questions in the Q&A section, or majority of the questions. So he may also take upon the questions on his on yourself, sir. आपसे भी request है, आप अपने आप से भी questions you can take. You can take question whichever you feel relevant to answer. And with your permission, may I take the opportunity to start this Q&A section?
Yes.
Thank you, sir. Sir, one question is there from Dr. Shrikant Puthalji. Dr. Shrikant is asking that indications for Brahmani Chikitsa and the indication for Rasayan Chikitsa. How do we intervene that?
Yes, in Prameha, the problem is that although in the beginning there is increase of weight and medas, gradually Dhatu Chaya happens because the body is not getting nourishment. Patients begin to have muscle loss, weakness. So it is in the advanced stages that we have to actually do Brahmana Chikitsa. Clearly indicated in the Pitta or Vata stage, not in the Kapha stage of diabetes. And also after we do the Shodhana and Samshamana, that is when we can start Brahmana treatment. This is very critical because just because the Dhanvantara Ghritam is indicated in diabetes doesn't mean that we can give it to all diabetic patients. That's what I was trying to point out. But in the right stage, even fat, the right kind of fat is actually helpful and it can support the diabetic patient. So Ghrita, I have used it for in some complications also it is helpful, but after you do the Shodhana and Shaman, otherwise it can, and you have to stabilize their Agni. Otherwise it will become Ama, that Brahmana will become Ama. Then it will again produce that whole cycle of Rasadhatu, Meda, Kleda, and it will create a problem. So without Shodhana and Shamana, we don't go into Brahmana.
Right. Thank you so much, sir. So
then
that
Rasayana is after that. Rasayana is at the end. Once we have stabilized everything and the patient, unless the patient has become stable and stabilized, we cannot start Rasayana treatment. So,
right. Thank you, sir. So that means first we need to understand the status of the patient's Agni, status of his Kleda Avastha or Ama Avastha or the Rasa Avastha. Thereafter, once we are once we are satisfied that these things have been taken care of, then we can go for Brahmana Chikitsa or later stages Rasayan Chikitsa.
Yes. Brahmanam, Deepanam, Agni, Agni, Dimmanan, Deepanam, and Sroto Vishodhana. All the three should go together. Otherwise, Brahmana will produce Ama.
Ji. Thank you so much, sir. Another question is there from Vaidya Arikma Avasthi ji. Vaidya Avasthi is concerned, I mean, she want to, or he or she want to know, like when Vasant Kusmakar, usually what happens, sir, when the patient arrives to the Ayurvedic physician, we have a preoccupied mind that we need to give them Karela, Amla, Haldi, Methi, and Ajwan, etc. And Vasant Kusmakar Ras and all. So when I can understand the question of Vaidya ji, that they want to know, like, when can we intervene or when can we prescribe this Vasant Kusmakar Ras?
Yes, actually, I don't have. You see, I'm coming from Kerala. We are usually treating with Kashta Aushadhis. So I do not have much experience. But from what I understand is that all Rasa Aushadhis are like Rasayana. I mean, they are helping in, this medicine, Vasanta Kusmara, is very good for rehabilitation, for, recovery. So I don't think it should be considered as just for sugar control. It can probably be a very good support because Rasa medicines, usually we use a very few medicines in Kerala. We are not using much, as you must be aware. We are mostly Kashta Aushadhi people. So I've actually not used it. One other Bhasma which we are using is the, Vanga Bhasma we are using. So, from my little understanding, I'm not an expert because I don't use Rasa medicines first. It is helpful in preventing complications, in supporting the kidney functions, in improving the energy levels. That is where I think it is generally helpful. But since I have not used it, I'm unable to, give a very clear answer to that.
Yes, sir. Thank you, sir. Another question is there from Vaidya Patil. He wants to know, sir, Patil sir want to know, like clear the Pradhana Vyadhi, Rukshana is indicated.
Yes.
But wherein if the patient is already Krisha Pramehi, then what should be our approach in that person?
Yes. I mean, that is the thing where, we have to use the Kalpana very, very carefully. So, in Vatika stage, we cannot do too much of Rukshana. And that is why that Prameya is also called Asat. It is not easy to treat. It is not easy. That is why we have to prevent the Prameha by coming to a stage where Rukshana is not possible. In Kapha Prameha, the Kapha stage, it is very easy to do it. But you can try very carefully that, you have to balance the Rukshana and Brahmana very, very carefully. You may be able to handle it like using gridams like Gugulu Tiktakam, but it is risky. It is difficult. Viruddhova Karmatam is there. That is why Vatika Prameha has been considered to be Parityajya, not to be treated at all. But we can still treat. In my experience, if you very carefully balance it, we'll be able to give them some support. But I have not found it possible to completely reverse or give dramatic results when it has progressed to that stage.
Yes, sir. So that means, I mean, we need to understand our limitations as well, like.
Yes, that's very, it's not a cure-all. In Prameha, very clearly, Charaga has said, Yascha roga samuthanam na shakyamiha kenajit parihartum na prapya chojidavya manishina. Don't create a disease and bring it to a stage where nobody can treat it and then cry. So early intervention, that's why I talked about the IDRS score. We must create awareness in society. Tell them that early, even like in cancer, people are afraid, so they are a little bit more willing to start early. But in diabetes, people think with all this insulin and other things, it's okay, they can still live. But if we can create awareness, we can catch diabetes at more early stages where Ayurveda can be better.
One more question with your permission, sir. Dr. Rafia Hassan, she is asking about why in the family, if taking same diet at the same time, following same lifestyle and regimen, only few people are susceptible to have diabetes, but the rest of the people don't have diabetes and all. So how can this be prevented, or what could be the understanding of that, and what should be our approach?
Yeah, there is always an interplay of genetic factors. Everything is not from the family. So family is one of the factors. There is lifestyle. There's an interaction between these two things that actually produce an illness. Even in modern medicine, it is not fully understood. What is generally understood is that lifestyle. This is called epigenetics. Even if you have a lifestyle factor, so we must also look at them. I don't believe that it is possible even in a family for everybody to follow exactly the same thing. That we are telling that, but Does it mean that everybody is from morning to evening following exactly the lifestyle? No. Their prakriti is different, the way they are behaving in their life is different. So we have to really account for that. There is genetics and epigenetics. So that very premise that I think is very theoretical, that everybody in the family eating exactly the same food and living exactly the same way, going to sleep at the same time, waking up. I don't think we are not doing ballet dance here in our life.
Yes, sir.
We are living all in our own ways. So it's very heterogeneous. So there are factors. They must be getting exposed to other triggers that, bring up this diabetes, that we have to analyze and understand. But the entire mechanism is still not fully understood. We know that there are genetic factors and there are lifestyle factors.
Yes, sir. Like rightly said that no two people are same. That concept is applicable over here probably.
That is applicable, and I don't believe that even though they are living in the same house, their lifestyle is also always the same.
Yes, sir.
It's impossible.
Yes, sir. Another question, sir. Like Dr. Sujata, she was Dr. Sujata Solanki ji. She wants to know about like some people, some patients have increased fasting blood sugars, whereas some persons or some patients have increase in the postprandial blood sugars. Like there is no uniformity in such kind of thing. Even we get patients in clinical practice as well. Sometimes they have increased PPBS, or sometimes they have increased FBS and all. So, like she's concerned, or rather, we all want to know, like what should be the approach in that case.
That's why this is something which I have faced also. That's why I brought the theoretical understanding of sthayi rasa, ahara rasa, and asthayi rasa. So if it is, PP sugar which is increasing, the problem is with ahara. If so, you can focus on the food and, then you have to control it. That is what even modern medicine indirectly is saying, that if it is fasting sugar, then it is Thai rasa. It is a more, at the Thai rasa level. And if it is random blood sugar, it is Asthai rasa. Now, once this understanding from Ayurveda comes, we can focus on these aspects of rasa and then handle it better. That is how I am understanding. But from modern science, any of these parameters, if it is more, they consider it as diabetes.
Okay, so I'm really delighted to know this concept of Thai rasa and random rasa, because it was something which we have missed, or probably it just gone off from our mind.
So, I mentioned that because the ahara rasa, because when postprandial sugar means the time when ahara rasa is created out of food. So the whole increase of that blood sugar is happening due to ahara rasa problem. So in my experience, what I do is I work at the Jadaragni level. So if you work at the Jadaragni level, you can prevent the ahara rasa driven postprandial sugar increase. If it is, Thai rasa, then you have to work at the level of rasadhatu itself. In the rasadhatu agni, you have to work. If it is asthai rasa, then the conversion of rasa dhatu to other dhatu, that is the level where you have to. So if you work approaching this way, I think Ayurveda has a much better explanation for this than, because in modern medicine is not explained very clearly. They do mention certain phenomena.
Very well said, and very well the insight. One last question with your permission, sir. I know we are running short of time and we have taken a lot of your time, sir. But one question I'll just put. Dr. Jaya Gupta, she wants to know, or rather, we all want, like we are getting patients in the clinics wherein the patient is diabetic, and because of probably peripheral neuropathy and all, they have some sexual dysfunction. Yeah. So, can you, sir, please guide us, like what best can be done in that case?
Yes, that these are all the tender. So, by reducing kleda, meda, this is a complication of kleda. Testes, the kidneys, the heart, these are all even sensitive to Svedana. Kidneys are little protected inside. So Ayurveda has told eyes, we should not do Svedana. We have to protect it. Heart also, we have to do Svedana. Testes also, we shouldn't. So kidney also same, but it is not mentioned because we don't usually do Svedana too. So these organs are very tender and they cannot withstand the kleda in the body. So that is why there is diabetic retinopathy, which is the eyes. In Ayurveda, we have told Svedana should not be done to the eyes. Then cardiovascular disease, because heart also Svedana. You have to put lotus leaf and all that if you are doing any Svedana. Then the testis also and the kidney. So these are the common nerves also very sensitive to this Vidaha, which is happening in diabetes. So Vidaha Prashamana Dravya are very helpful in preventing the damage. And, to some extent, it can reverse. So Kleda management is in my experience and understanding. After that, we'll have to do Brahmana and Rasayana to bring back that function. But the first step is in controlling the Kleda.
Okay, so pardon me, sir, if I'm and if I fail to understand, that means like we need to first do the shoshana of the kleda by means
Yes.
of vidahi dravyas.
No. Vidahi is the dravyas which prevent Vidaha and which remove the kleda. Two things are involved in this neuropathy, nephropathy. Vidaha is, that Vidaha is like an inflammatory process which actually damages. This kleda is what causes the nephrons to, get damaged, the retina to get damaged. That is how then the nerves to get damaged. So that kleda should be first controlled. And then the Vidaha process, because of this kleda remaining inside, it triggers a kind of very difficult to translate Vidaha, but it is, a slight burning kind of thing, which causes the damage to these organs. So that should be controlled. And after that, we have to see how much we can recover. If the damage is too much, then, we may not be able to reverse it.
Yes, sir.
So that is my experience. To some extent, these things could be restored by doing this treatment. After that, we give some Brahmana. Because once the testis and all that whole reproductive system is affected, we have to give it Brahmana treatment again. After the removal of the kleda. This is what I have understood for all the complications of the removal of the kleda, and then reversing the damage that has happened, and then doing the brahmana and restoration of that all.
So we are delighted. So thank you so much for this insight actually. And personally, I'm very, 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 very thankful to you, sir, for this wonderful insight guiding us. And if you would like to take any question from your end, sir, please you may address, sir.
Yeah, I think I answered about 25 questions already in the chat, 23 questions already. So, there are some questions which I see now. What are the diseases systems from modern aspect that Prameha spectrum can fit in? Okay, that I already explained, that it is diabetes mellitus plus many other conditions like bilirubinuria, hematuria, all those things come into the whole Prameha spectrum, but out of which diabetes, because some of those things are seen also in diabetes mellitus, that is why they included. That was an Ayurvedic style of ancient way of describing diseases. But all of them are not diabetic. So I think that I explained. And let me just see.
So we have another program. We just, as a company, we wanted to request you to launch a program for us.
Okay.
Yeah, to all the doctors, we are launching a content writing competition. So I took the opportunity of having Dr. Ram Manoharji over the platform to please officially help us launch the contest, sir.
Okay, so yeah, I'm very happy to learn about this Kairali platform. I see that this gives a lot of opportunity for doctors, to not only for learning but also to engage themselves in the practice of Ayurveda. And this, I think, the Ayurvedic community coming together on a network is extremely important, because in modern medicine, this networking is what, because now we are all doing our things in silos. So I think such initiatives where practitioners come together, they learn about things, this will bring a lot more of standardization guidelines in all this practice. And so I think Kairali Ayurveda taking such initiatives is really commendable. And today I'm very happy to announce about this content writing competition, which, this is also very interesting because in Ayurveda, we don't have enough incentives, to professionally grow. So such opportunities really encourage clinicians to also come out with their skills in a way that is incentivized. So I think this content writing competition is very commendable, and so you can. I think this details will be mentioned by Dr. Rishabh, but this is about choosing appropriate topics and writing about it from your clinical and research perspective. So over to Rishabh Gupta for further details.
Thank you, Doctor. Thank you so much, Doctor. I really appreciate the presentation and your time. I'm really grateful, and I hope and thank you, Avneet. Your platform looks very impressive. I'm sure we will be able to get a lot of doctors, and it looks a commendable platform that you have built up. And thank you so much. Now, we'll just wrap this webinar in the next 10 minutes. So I want everybody to just stay back just for 10 minutes. I just need 10 minutes of yours. So now I would like to invite Mr. Puneet Endle, who is the Vice President Sales. So he's just going to talk about our product lines that we have so that you can get an idea which will help you in for your patients and for your clinic on how to use those products and what all products we have, especially for diabetes and other diseases. So Puneet, you can just run through. You have only 5 minutes, Puneet.
Sure.
So 5 minutes, you can just talk about say about a product and share some details about the products, especially if something is related to our disease for today.
Sure. Thank you, Rishabh. Thank you, Dr. Ram Manohar, for your insightful thought process, insightful education that you have imparted today. Thank you, Dr. Sachin. Thank you, Avneet. Let me just introduce you Kerala Ayurvedic products to you. We have a complete range of Ayurvedic products, proprietary medicines, oils, grith, churnam, kashayams in our portfolio. We have our manufacturing unit in Kerala as well as in Tamil Nadu, where we manufacture the entire classical range of medicines. And specifically, we have the diabetes medicines available. We have a Nisha Katakadi Kashayam, which our practitioners are using. We have a patent medicine called Diaspa, which is a very, very affluent medicine in this particular disease, which helps the glucose levels to come down. And it is very much trusted by the entire the fraternity already who are using these medicines in our of our company. We also, let me just also tell you that we also help doctors to introduce their own medicines in case they have their own formulations. We help in developing those medicines in private label. We can develop the medicines in their brand name. We help in getting the license for proprietary and patent medicines and entire turnkey solutions for launching your own brand, basically. And we have been associated with lots of doctors from Bangalore, Delhi, Chandigarh, who are getting their own medicines manufactured in our facility. And this is basically their own formulation. So they can use the classical formulation and twist and tweak, and we can get proprietary licenses in their name. And we do that. We have a complete range of more than 373 to be precise medicines, Ayurvedic, classical, proprietary, patent, cosmetics. The list of those medicines will be shared on the Telegram and various other social media groups. And I think Rishabh has shared most of the numbers, and our team will get in touch with you post the webinar and help you out in understanding the range of our medicines and probably expand your portfolio. And we'll definitely request you to use our medicines to support us in your practice and test our medicines on your patients, which are very much trustworthy. And we are a 111-year-old brand. So definitely 111-year-old legacy might help you in treating your patients. So let me just hand over to Rishabh. You can take it forward. In case we have any queries, we can share it on the Telegram group, and we'll send an email to Dr. Manohar to answer these queries of those doctors which are remaining, basically. So over to you, Rishabh.
Thank you, Puneet. I just want to announce, I saw very good engagement and a lot of questions were flowing in. So we have selected 3 winners, and those 3 winners will be eligible for a 3-night, 4 days package of our luxury Ayurvedic retreat. So the first winner is Dr. Rafia Hassan. She is the winner for the one of the best questions that she asked. Second winner is Vaidya Patils, and the third winner is Dr. Jaya Gupta. So these three are the winners. Congratulations to all, and we will be sharing the voucher details with you over the email. We have your email, and I would request you all to join the Telegram group. We will just take 2 minutes. I will just run through the presentation that we have for the content writing competition that we have started, which Dr. Ram Manohar have introduced. So this competition is basically for all the Ayurvedic doctors, students, professors. So they can join the Telegram group, and we'll be sharing all the competition details over the group. So they have to submit. There will be a specific topic every month that will be flowing in, and everybody has to submit the content through a Google form in a Google Doc or a Word document. And there are certain rules which we'll share it over the Telegram group. And the prize, the first prize, which is the most important thing, the first prize will win a cash prize of 5,000 rupees. This is a cash prize. Second prize will get a 3,000 rupees. And certificate will be given to all the winners, plus participation certificate and a gift voucher. Gift coupon will be given to all the participants. And the August 1 topic is all about Dhanvantaram Thailam. So these are the questions that they have to write. This has to be a genuine content, self-made content that has to be taken care of. So this is the topic. We're going to share this topic over the Telegram group, and then everybody can participate. If you have any queries on the competition, feel free to get back to us. And now we come to an end of the webinar. I thank you so much. And we will be sending gift vouchers over the Telegram group. Certificates will be given over the Telegram group to all the respective people. Certificates will be on a digital copy, so they can download the digital copy of the certificates. And now we come to the end of the webinar. I thank you so much for coming and taking time. Thank you, Dr. Ram Manohar. Thank you, Avneet. Thank you, Dr. Sachin. Thank you, Puneet. And I thank you all the entire team of Kerali and NatureFit that they have come forward and collaborated. And I think so we have done a tremendous work, a very good work. Way forward, we'll be organizing more webinars, more CMEs on different topics. And we will be connected, and we will, the mission that we have decided, Mission Ayurveda, we will spread across the globe. Thank you so much, and namaste to all. Thank you.
Thank you so much.
The webinar recording will be shared with everyone. So feel free, anybody wants to refer the webinar recording, that will be shared with all of you.
Namaste.
Yeah. Thank you. Thank you.
Great
so
job,
much.
Rishabh and team.
Thank you so much, Arvind. Thank you.
Thank you, sir. Yeah.
Thank you.